Understanding the root causes of degenerative disc disease can be a game changer in managing your spinal health. In this video, I'll reveal the three main causes of degenerative disc disease in a way you've likely never heard before. I'll break it down into simple terms so you can easily grasp what's happening to your spine and why. Now, this isn't just another health video, it's your first step towards taking control of your back health. How? Because I'll also share how you can stop and even reverse degenerative disc disease using common sense and natural methods. Plus, I'll reveal the one thing your doctor might not have told you about maintaining your spinal health. Be sure to watch right to the end so you don't miss out on essential tips and unique insights that could be the key to improving your spinal health. And remember, if you've tried other methods without success, it's not your fault. Healing is a journey, and sometimes finding the right path takes time. This video offers new hope and methods you might not have tried yet. Let's dive in together. Hi, I'm Dr. John Zielonka. I'm a neurofunctional chiropractor in Ottawa, Ontario, Canada. I've been doing this for over 30 years now. I'm the author of 10 books, including my latest, Low Back Pain is Not a Life Sentence. I'm the founder of National Health Day in Canada. I'm very honored to say we've been voted Ottawa's best 16 times. As well, I've had the privilege to work with some of the world's best athletes. My YouTube channel focuses on helping those who've been suffering with debilitating chronic back and neck pain. Now, before I dive into today's video, I need you to hit that subscribe button if you want to learn more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs or surgery. Can stopping or even reversing degenerative disc disease and degenerative joint disease even be possible? The answer may surprise you, and I'll get to that shortly. But first, let's dive into the three main causes of degenerative disc disease to better understand what it is we're dealing with. So to understand the causes, we need to understand what degenerative disc disease really is. So what degenerative disc disease is, if you take a look at the model of the spine, you've got your vertebrae, you've got a nice thick disc, you've got another vertebrae again, that would repeat where you'd have another disc, another vertebrae, another disc, another vertebrae, all the way down. The yellow guys you see come out of here, those are the nerves. They come right off the spinal cord, which is inside the spinal column. That goes up to the brain. That is your body's own internet system. It's the hardwiring of your body's own computer. What degenerative disc disease is this disc will literally start to wear or thin out. So what happens is instead of having this nice thick disc, you'll see that the disc will actually start to thin. And so when that disc starts to thin, not good, because it'll actually have less room, less of an opening for those nerves to come out. Now, the thing is, when I use the terms thinning or wearing out or spinal decay or spinal deterioration or degenerative disc disease or degenerative joint disease or osteoarthritis, they really all mean the exact same thing. It's this wearing and tearing of the discs. And so in a phase one, well, normally nice thick disc. In a phase one, you can see that disc has clearly thinned out. What happens in a phase two is you'll find the body doesn't like the fact that you're actually thinning out that disc, so it now starts to grow what we call spurs or osteophytes. You're getting a bony growth here, and what the body's trying to do is the body is literally trying to fuse you together, because it figures if you're fused, well, then at least you're not going to be able to turn anymore, and you're not going to put even more pressure on the nerve. That is not a good thing. Okay? It's actually how they used to do low back surgery decades ago, and they now know it was a terrible way to do low back surgery, because you'd be fusing the next one and the next one a year later and a year after that and so forth. So that's what degenerative disc disease is. A classic sign is morning stiffness. So for all those of you who are waking up really stiff in the morning in the joints, almost always that's degenerative disc disease. And the reason that you're stiff is because what's happened is during your sleep there was very little movement, no matter how much you roll around in bed and so forth. And it's that movement that pumps blood flow into those discs. So until you actually start walking around, moving a little bit, that's where a hot shower in the morning is the one time it actually makes a little bit of sense, get some blood flow going to the area. Also, other interesting thing is those of you who find that your joints are affected with weather changes, this is not a myth. What's happening is when there are pressure changes in the atmosphere, the discs have to adapt to this. If you have a normal, healthy disc, then that's very easy for it to do. If that disc is degenerated, it has a much more difficult time adapting to those pressure changes, which is really why I've always said that all weather forecasters should have some form of osteoarthritis. They would make their forecasts a lot more accurate. Now let's get to those three causes. So cause number one is you're just told this is just inevitable with age, and what do you expect as you're getting older? That's not true. Since this is a wear and tear, the first thing that's going to cause this wear and tear to speed up is if you damage that disc. So that damage can be what I call fast damage or slow damage. Fast damage is going to be your injuries, your accidents, your falls, and so forth. What they don't tell you if you've been involved in a car accident is on average you sped up the degeneration in your spine by about 10 years. If I damage something, it's going to wear and tear faster. If your car got in an accident, guess which part of your car is going to rust first? Number two, the second thing that speeds up that damage is a lack of movement to the area. And the reason that that's true is it's movement that pumps the nutrients into the disc. So it's a big fancy process called imbibition. And what it means is it's movement. There are no blood vessels that go directly into the disc. So it's the necessary movement that pumps those nutrients in. As we start to lose that movement, we're getting less nutrients pumped into the disc. If we're getting less nutrients pumped into the disc, what a surprise, again, you're going to degenerate faster. And then cause number three is, again, what they're not telling you is the body's capable of producing the nutrients that actually build that disc in there. It stops doing that about age 40 or so. So this is the reason that these discs start to degenerate more as we get older. It's not because of age, it's because we're not doing anything to counteract the three things that are causing that. We're not doing anything to correct the damage, we're not doing anything to improve the movement, and we're not replacing the nutrients that are missing from the body. So given that you now know the three main causes, can stopping or even reversing degenerative disc disease and degenerative joint disease even be possible? The answer is a resounding yes. And we've actually done it many times in our health center. How do we do it in our health center? Well, we look, it's this common sense thing, we look what are the underlying causes that created it in the first place. So number one, we were talking about if we damage that vertebrae, if we damage the spine, it's going to wear and tear faster. And let's also make clear the point that damage can be what I call fast damage, which are going to be your car accidents and your sports injuries and your falls. It can also be what we call slow damage, where it's those bad posture, chronic work postures, where you're getting an uneven amount of pressure on that disc, but over a prolonged period of time. So maybe not as much force, but a much prolonged period of time. Well, number one, if we correct the damage, that's going to take some of the pressure off that disc in the first place. Number two, I just told you as well, that it's a lack of movement specific to each individual vertebrae. And this is key because then some people will think, well, hey, I can just go and exercise. No, exercise by itself is not necessarily going to fix that because, for instance, if you had osteoarthritis in the neck, you may say, well, I'm just going to turn a lot more. Well, you still may have two vertebrae that aren't moving at all relative to one another. So one of the key things that we need to do is we need to restore the movement to each individual set of vertebrae. And then number three, if we know it's a lack of nutrients getting into the body and the body stopped producing those nutrients, then we supplement with those nutrients. But again, this is not the buy the box store or the drugstore brand. It's knowing the exact nutrients to rebuild the disc and the cartilage based on your individual needs. Now, have we done this before? We've done this many times before. We have a number of case studies. Okay? Case study number one is Adrian. Adrian's a 65-year-old Ottawa man who'd been suffering with severe chronic low back pain and degenerative disc disease for over 10 years. He couldn't bend, couldn't sit in a low chair for fear of not getting up again, couldn't even put his own socks back on. In fact, he was let go from work due to his low back disability 9 years ago. Okay? What did we do for Adrian? Adrian, okay, we've actually seen a 30.5% increase in his L5-S1 disc and a 6.6 degree increase in his L4-5 disc. Same for Dan. Okay, so Dan, a 56-year-old man had been suffering with severe chronic low back pain and degenerative disc disease for over 20 years due to his professional career as an elite research and rescue specialist. So this is a guy who would be saving you, putting on his scuba gear if you were in the middle of a lake. This would be the guy who'd be rescuing you in the mountains. This is a guy that I would want to actually have a back in good shape. And according to him, he said he had tried everything to reduce the pain short of surgery, which wasn't recommended. What did we do for Dan? Increase the disc height at his L5-S1 by 20.6% and at his L4-5 disc height by 19%. Okay? Same case study, another case for Jim. Okay? So resolution of L3-4 spondylolisthesis and reversal of osteoarthritis and degenerative disc disease at L4-5 and L5-S1. In Jim's case, he found himself crushed between a dump truck and a guardrail on the 417. We've increased Jim's disc height in as little as 8 weeks, both at the L4-5 and the L5-S1 disc. Okay? Now, this is important to understand that it's not just with the typical things that people would try for this. Is one of the key things that we utilize is also something called non-surgical robotic laser spinal decompression. It's the only one of its type in Ottawa. There are only 12 worldwide that are seeing this type of result as part of our neurospinal restoration programs. Now, what's the one thing your doctor doesn't tell you about spinal health? Well, I think you figured it out at this point in time. It's not age. It's what you do or what you don't do over those years. So yes, if we do nothing, that degenerative disc disease is going to progress. But there are things within your power that can be done to slow that, to in a lot of cases stop that, and as we've shown, we can actually even reverse that. And think of the difference that would make in your life as you do get older, the ability to still maintain your mobility, to still have your freedom of movement, to not be isolated and so forth. This is of key importance. And again, you're not going to get this just from basic exercise. There is no drug or surgery that's going to restore this for you. You've now learned that degenerative disc disease doesn't have to be a life sentence or lead to a life of disability, limitation, and suffering. By understanding what's actually going on, we can take a logical, common sense approach versus the loss of hope and the drugs that people use just to deal with the symptoms. I hope this video has given you valuable insights to take the right steps toward getting the help you need and improving your condition. Now it's your turn. What treatment methods have you tried for your back and for your degenerative disc disease? Have you incorporated any specific exercises into your routine? Please share your experiences in the comments below. Your story could provide hope and guidance to others navigating similar challenges. If you found value in this video, go ahead and like it and share it now so that we can help more people suffering with back pain and leg pain, whether it's from degenerative disc disease, disc herniations, or stenosis. There is hope. You just need to take the right action. Be sure to subscribe if you want more tips and strategies on how to treat and relieve debilitating back pain and neck pain without drugs or surgery. Please watch this video next, where I share 3 inspiring success stories of patients who found relief through non-surgical robotic laser spinal decompression. This is a must-watch video for anyone seeking alternatives to surgery for back pain, for leg pain, for degenerative disc disease. Please go watch this video right here now.